Let's talk a little bit about the aging of the forehead. We'll start from the top of the head and work our way down. The aging of the forehead is essentially rather simple. The eyebrows descend, gravity does its thing, and what we end up with is a more tired look. Sometimes folks say it's an angry look, and they want to have that changed if possible. The traditional techniques for treating this are brow lift procedures or forehead lifts. And the traditional forehead lift involves an incision from one ear all the way across the top of the head to the other. Now there are some variations as to where exactly that incision is placed, but that's basically the idea. And the idea is you essentially move the eyebrows superiorly and you remove some extra skin and you cut it out and you sew the skin back up. Now this technique is effective at raising the eyebrows. No one can argue with that. However, there are some downsides to this technique. One is with this large incision, you're essentially guaranteed numbness of the scalp posterior to that incision line. Secondly, with this large incision, you do have increased recovery time, lots of bruising and swelling, which takes weeks for it to go away. One of the newer techniques which is available, one of the first minimally invasive techniques, was an endoscopic brow lift. Now what we mean by this is we actually make smaller incisions in the forehead behind the hairline where they're not visible, as shown here in this diagram. And with these incisions, we use specialized instruments to visualize the dissection process that we go through. Furthermore, we actually can see the vessels, the blood vessels, the nerves that we need to preserve. We can see the muscles that we want to either cut or move and take care of it all through there. And actually there's a picture here of a live shot with the endoscope. This is an example of a patient who underwent an endoscopic brow lift. With this procedure, you get, in my opinion, a more natural lift of the eyebrows. The before and afters here are labeled, and in the after picture you see that there's a nice elevation of both the lateral arch of the brow and the medial portion of the brow. And in the glabellar area, these frown lines that had existed previously have been softened up significantly by lysis of the corrugator muscles. If we compare the open techniques and the endoscopic techniques, we can see several advantages and disadvantages we should discuss. The advantages of the open technique, per the proponents of that technique, are that it requires less equipment and direct visualization of the dissection process is allowed. I would submit to you that most patients probably wouldn't care about that. That's really a surgeon issue. The disadvantages patients probably would care about, and these are the risk of hair loss along the incision line, scalp numbness posterior to the incision line, and the recovery time associated with this procedure. With the endoscopic technique, however, we have less numbness or no numbness of the scalp, smaller incisions, no significant hair loss because we're using much smaller incisions, and more rapid recovery for all of the above reasons. The disadvantages, according to the proponents of the open technique, are that it requires equipment, and again, I would submit to you that most patients probably wouldn't really care about that. One criticism of the endoscopic technique is that it may be less effective. In order to investigate this, Laferriere published in 2002 a 10-year retrospective study comparing open and endoscopic brow lift techniques. With this study, two different open techniques, the coronal and the trichophytic, which I won't go into detail on, but essentially involve that large incision, were compared to the endoscopic technique. The same surgeon performed these procedures. The medial brow was measured, and the highest elevation of the eyebrow, the arch point, was measured. Within hundredths of a centimeter, there was essentially no difference statistically in the elevation achieved with any of these techniques. So this is a nice example of a technique which is safer, requires less recovery time for our patients, and is equally effective to an open technique. So it's really an ideal minimally invasive procedure.